But again, it's really an honor to be amongst mentors, many mentors, guides along the way, and it's hard to believe that 17 years have passed being here, and here we are today. So I just wanted to, I was lucky in my fellowship days, again, as has been mentioned, all of the esteemed individuals who are here, to really support my passion, entering a research fellowship, really doing work in medical education. And that really was a visionary leap of faith that began with Russ Phillips and then continued by Helen when she brought me on as the Associate Director of Education for the Osher Center for Integrative Medicine. And really, in that was a pillar. We were sort of always thought of as silos. There was clinical care research and education, and we moved into how do we integrate this? And as Matt beautifully mentioned, that can the clinic become an incubator for education? How do we actually translate the research that we're doing into the practice of clinical medicine? And I had the privilege of working closely, especially here at Harvard Medical School, in various roles. So we've already heard many highlights of the T32 research fellowships. I won't say those were just, Gloria mentioned them in exquisite detail. We've heard about the integrative medicine grand rounds, and one of the successes that I just want to highlight here is that we've had increased participation and involvement and engagement as we moved into the virtual format due to the needs of our time in the pandemic. We've had the Integrative Medicine Network Forum, which really has reinformed our leadership here at the Osher Center for Integrative Medicine as to how do we actually continue to keep the network engaged and aware of itself, and how do we expand and grow that network, and I'll show you just briefly. And then finally, continuing with the next generation. I thought I was the next generation, but now there's another generation after it, and they are really truly amazing and inspiring to be and work around. And so here we are, and we have, again, how do we keep that engagement? So the Integrative Medicine Grand Rounds, I just want to quickly say that you can see that graph that was seen earlier today. We have exploded. The engagement, especially virtually, has really helped create important and critical dialogue around advancing the science and practice of integrative medicine. And we've really done an amazing job of really representing the diversity of presentations, both in the presenters, but in the topics of presentation itself. We've increased opportunities for junior faculty and fellows, and we've had a growing community engagement. And also importantly, we've engaged our really the network of the Osher Collaborative to participate and to really provide meaningful opportunities for us to hear about the amazing work that is being done across our sister institutions. So again, we want to continue and build upon this. The Integrative Medicine Network Forum, again has been an amazing experience to be a part of this team in the beginning, as was already mentioned by Peter, but more recently, we've really been able to address timely topics, and these included also being able to transition from in-person to virtual topics. So just to give a brief example, our 2020 presentation forum was entitled Learning Horizontally and Vertically, Building Networks Within and Between Healthcare Professions. We had topics on diversity, equity, inclusion in integrative medicine and health before it actually became part of the national dialogue in integrative medicine and health. We were talking about healthcare provider resiliency and how integrative medicine and health can really be a key pillar in helping promote that, and also interprofessional education. And I'm proud to say that even our upcoming work, and this is through my other hats, that we have been able to engage also the National Academy of Medicine leadership, who many of you know here. President Victor Zhao will be giving our keynote this fall on that very topic as well. The 2022 event is the Lived Experience of Depression, and this is our first two-day event. And really, this is an amazing lineup where we have keynotes, Dr. Vikram Patel, Dr. Ann Harrington, Dr. David Rossmarin. This is really to create a greater understanding through cross-disciplinary dialogue rooted in scientific inquiry, multidisciplinary and cross-cultural perspectives, and clinical innovation, and really to examine integrated medicine approaches to depression, distinguishing between curing and healing, as Don has pointed out so beautifully, discussing cultural themes and defining and managing depression, and review cutting-edge approaches. I would encourage all of you to attend, participate. This is going to be a one-of-a-kind event. I think I would argue almost one of the first in our field to happen in this particular way. We've had tremendous presence in terms of at HMS now, and it's really guided by the desires and passions of our students. I serve as the faculty lead for the Resilience and Wellbeing curriculum for all first-year medical students, and we've had to innovate, which was once in person to becoming virtual and now becoming hybrid. And every year the curriculum innovates with collaboration from our students. I serve as a site director for the Practice of Medicine course, which is a required course for all first-year medical students at Harvard Medical School. And in that, we obviously have dialogues on how do we take a good history, how do we really understand the cross-cultural perspective that many patients bring as they discuss integrative medicine health. I lead the themes on cross-cultural care that is talked about in their first weeks of medical school here at Harvard Medical School. And then on the graduate students side, we've been working with Dean Joanna Gutlerner, who many of you know, on really how do we create resiliency programs for the STEM pipeline that is, especially in underrepresented and marginalized populations, is suffering quite a bit, especially around recruitment and retention. And we had a pilot experience. This is in collaboration with some of the work that we've done at my other hat at the Benson Henry Institute for Mind-Body Medicine, adapting that program to the needs of our graduate students. And Peter and I led this experience using a curriculum and adding a Tai Chi, a movement component to it. And what did we find? And again, I wanted to give you just a taste of this. These students started at the level of above that would be predictive of burnout. And again, this is a pilot, and it just gave us a signal to look at. And when we put them through this resiliency program afterwards, we got them under that level. And again, it just goes to show that things are possible. We can actually make meaningful change in our students' lives, especially we invest in them to become the future of both our research, clinical, and educational pipelines. And here's the important point, I think. I just want to say that when they were stressed just as much before as they were afterwards. But ultimately, their ability to handle stress changed. And I think this is one of the things that our fields in integrative medicine health can offer, is the ability to handle. We are not going to be able to change the stressors that are around in the world around them, but we can help them cope better. So again, you can see the quotes, they speak for themselves. These tools are absolutely essential to navigating a high-stress academic environment, which is representative. These come from our institutions here. I feel like I've grown a lot in this short period. Overall stress levels have reduced. I'm better able to recognize when I'm stressed, anxious, or depressed. We have really taken a lead on diversity, equity, and inclusion efforts in integrated medicine health. As I mentioned, our 2020 Network Forum featured two deans here at Harvard Medical School and Harvard School of Public Health. Dean Michelle Williams, who many of you know is the Dean of the Harvard School of Public Health. Dean Fidencio Saldana is the Dean of Students at Harvard Medical School. And we had Dr. Joe Betancourt, who is the Senior Vice President for Diversity, Equity, and Inclusion at Mass General Hospital. And you can see this amazing dialogue that we were able to foster amongst these thought leaders. And it was really an amazing model of bringing people together in a virtual environment. We've also written quite a bit. Peter, Gloria, and I have written a piece in the journal formerly known as the Journal of Alternative and Complementary Medicine, really on reflections on race and mind-body medicine. Again, a topic that has not been talked about, but how do we talk about some of these disparities that exist in our field as well? I was asked to serve as the chair for the academic consortium for the task force on diversity, equity, and inclusion, and one of the first things I was able to do was write a piece to the entire academic consortium that provided reflections on the George Floyd verdict and our responsibility in integrative medicine health towards as we begin to deal with these important issues as well. I just want to also give a preview of some of the other efforts that we're doing. In my MGH hat, I've been fortunate to lead this is one of the efforts that I've led as a producer, I guess, as a TEDx talk. We have a formal TEDx series that we're looking to expand now to an MGB, or Mass General Brigham level. And these are really amazing stories of how we bring community together, how people have handled challenges through innovation, resilience, vulnerability, and connection. All of the themes that we've talked about here today and previously as well. And then, certainly last but definitely not least, this is our big initiative. Atra we've recruited her back with great joy as she leads our new efforts on planetary health. And this is the new frontier. We are at the Osher Center really taking on an area that has not yet been explored by our field in an intentional way. And through Atra's leadership and Peter's obviously vision as well, really developing partnerships across HMS, conversations, for example, with the Planetary Health Alliance, which is actually led by one of our former Osher fellows, Sam Myers. And we had a chance to again begin dialogues with him. The Center for Climate Change, Climate Justice and Health at the MGH, Institute for Health Professions, where we'll be holding interviews in our Osher Speakers Series, so stay tuned. We'll be podcasts up on our website. Our Grand Rounds, David Victorson of the Osher Center at Northwestern will be leading a talk on the role of nature therapy. And then importantly, in our 2022 Network Forum, we will be having a panel that focuses on planetary health and its contribution to the treatment and approach to depression. So with that, thank you. This was a quick whirlwind, but thank you again for allowing this to happen. I'm going to turn it over to Peter to wrap up.